Population Policy and Family Planning in Bangladesh. Introduction. Population policy encompasses strategic initiatives aimed at influencing demographic variables such as population size, growth, distribution, and composition. In Bangladesh, effective population policies are crucial for sustainable development, resource management, and improving the quality of life. Objectives and goals of population policy. The primary objectives of Bangladesh's population policy include 1. Controlling population growth, implementing measures to reduce fertility rates and manage population expansion. 2. Enhancing reproductive health services, ensuring access to comprehensive reproductive health care, including family planning services. 3. Promoting education and awareness, raising awareness about the implications of rapid population growth and the benefits of smaller family norms. 4. Empowering women, facilitating women's education and employment opportunities to encourage delayed marriages and childbearing. Family planning programs in Bangladesh. Family planning is a pivotal component of Bangladesh's population policy, aiming to provide individuals and couples with the means to determine the number and spacing of their children. The government, in collaboration with various non-governmental organizations, has implemented several programs to promote family planning. 1. Contraceptive distribution. A wide range of contraceptive methods are made available through public and private sectors. According to the 2022 Bangladesh Demographic and Health Survey, BDHS, the contraceptive prevalence rate among married women is a key indicator of the program's reach. Cite, turn search. 2. Community health workers. Trained health workers visit households to provide family planning information and services, especially in rural areas. Awareness campaigns. Type, mass media campaigns are conducted to educate the public about the benefits of family planning and available services. Recent surveys and literacy rates. Literacy rates are a significant determinant of the effectiveness of population policies and family planning programs. Higher literacy levels, particularly among women, are associated with better understanding and utilization of reproductive health services. According to the preliminary report of the Population and Housing Census 2022, the literacy rate in Bangladesh is now 74.66%. Cite, turn, search 7. This improvement reflects the government's efforts in promoting education, which in turn supports the objectives of the population policy. Conclusion. Bangladesh's population policy and family planning programs have made significant strides in controlling population growth and improving reproductive health services. The increase in literacy rates further complements these efforts, as educated individuals are more likely to make informed decisions regarding family planning. Continuous evaluation and adaptation of these policies, in line with current demographic trends and survey findings, are essential for achieving sustainable development goals. Note, this analysis is based on data available up to 2022. For the most current information, please refer to the latest reports and surveys. Nabshir Part 2, Population Policies and Their Comparison, Bangladesh, India, and China. Introduction. Population policies vary significantly across countries based on their demographic conditions, socioeconomic development, and cultural contexts. This section explores population policies in Bangladesh, India, and China, focusing on their objectives, methods, and outcomes, while highlighting the differences between these countries. Bangladesh, population policy and family planning progress. The government of Bangladesh has aimed to stabilize population growth since the 1970s. As of 2022, 1. Policy objectives: reducing fertility rates and improving child and maternal health, increasing contraceptive use through public-private partnerships. 2. Outcomes: the total fertility rate, TFR, in Bangladesh has decreased to 2.0 births per woman, nearing replacement-level fertility. According to BDHS data, 51% of women access family planning services from the private sector. 3. Unique initiatives: home-delivered contraceptives by community health workers in rural areas, awareness campaigns on the benefits of smaller family sizes. India, a broad and decentralized population policy. India was the first country in the world to launch a family planning program in 1952. However, its policies vary across states, reflecting its size and diversity. 1. Policy objectives, encouraging the adoption of contraceptives and sterilization in densely populated regions, managing the imbalance in sex ratios through education and gender equality. 2. Outcomes. The population growth rate as of 2023 is approximately 1.2%, slightly higher than Bangladesh. Infant mortality rates have decreased to 29 per 1,000 live births, improving overall maternal and child health. 3. Challenges. Regional disparities mean progress in northern states like Uttar Pradesh is slower than southern states like Kerala. Cultural and religious beliefs often pose barriers to the acceptance of family planning. China. The case of stringent population control policies. 1. One-child policy, 1979 to 2015. China adopted aggressive measures to control population growth with this policy. It restricted most families to having only one child, penalizing violations with fines or denial of government benefits. 2. Policy outcomes. The growth rate was brought down to 0.5%, but this led to an aging population and a decline in the labor force. There is also a severe gender imbalance, as many families preferred male children. 3. Recent reforms. Recognizing the challenges, China has shifted to a 3-child policy since 2021. The goal is now to promote fertility while balancing economic demands. Comparison of policies. Bangladesh versus India and China. Efficiency in family planning services. Bangladesh's approach, focusing on community-level awareness and services, has helped achieve faster fertility reduction compared to India. Policy scope and intensity. China's one-child policy was far more restrictive compared to the voluntary programs in Bangladesh and India. India's decentralized model allows states to tailor policies to specific needs, whereas Bangladesh employs more unified policies. Population trends and challenges. Both Bangladesh and India face the challenge of early marriages and high adolescent fertility rates, while China struggles with an aging population and its socioeconomic impacts. Conclusion. Population policies play a crucial role in balancing economic development and demographic trends. Bangladesh's success in reducing fertility rates through accessible family planning serves as a model for resource-constrained nations. Meanwhile, India's state-specific efforts allow greater flexibility, though regional disparities remain a challenge. China's transition from stringent controls to a more encouraging policy offers important lessons about balancing long-term demographic goals. Moving forward, all 3 countries must continue refining their policies to address evolving social and economic realities.